It's 12 o'clock and we'll go ahead and get started. And first, I would like to say good afternoon and welcome to the HSC Speaker Bureau series. My name is Dr. Emanuel George, and I'm an associate professor in the College of Pharmacy. And I have the privilege and really the honor of being your moderator today for today's panel with some of my most amazing colleagues. You know, all of my colleagues in the College of Pharmacy are amazing, but you know, don't tell anyone, but these guys are rock stars. So, but don't let it go to their head. So, all right. So as you guys may know, this is October, and October is Pharmacist Month here in the stateside and globally. But also this week here is National Pharmacist Week that we've been celebrating all this week in the College of Pharmacy. And in today's panel discussion, we would like to talk to you guys, as you saw in the registration, around the topic of pharmacists during a crisis, a dose of health advice, solutions, and wisdom. Now, you guys can feel free to go back to your registration and look at all of the particular bio links and notice all of the backgrounds of our clinical pharmacists that will be on the panel today. But I would like to briefly take a moment to just introduce our panelists to you very quickly, and obviously I'll give them opportunity to expound on their backgrounds if they see fit based on today's discussion. So what I would do is, as I call out each and the scribe and talk about your backgrounds, please just wave your hands for our audience so they can know exactly who I'm referring to at any given time. So without further ado, I would like to first introduce Dr. Adenike Atanda. Dr. Atanda is a board certified ambulatory care pharmacist. She's certified in diabetes care and education specialist with practice in adult and geriatric care. Next, I would like to introduce to you guys Dr. Jennifer Fix. Dr. Fix is a board certified pharmacist in ambulatory care and geriatric pharmacy with practice experience in the community pharmacy setting and clinical services in gastroenterology. Next, I would like to introduce Dr. Meenakshi Ramanathan. Dr. Ramanathan is a board certified infectious disease and pharmacotherapy pharmacist with practice experience in the community pharmacy, mail order, jail health, inpatient infectious diseases, and antimicrobial stewardship. And last, but certainly not least, I would like to introduce Dr. Megan Wesling. Dr. Wesling is a board certified ambulatory care pharmacist with practice experience in primary adult care. Sorry. Now, we've broken today's discussion down into three main groups, and our panelists today will guide us through this discussion about achieving optimum health during a pandemic, and also share their solutions and wisdom about the role of pharmacists during such a time. We will start the question answer period about 40 minutes into our discussions. So feel free to go ahead and put your messages in the chat. Feel free to use the link. And we do have some that were sent in ahead of time. But again, feel free to add your comments, your questions in our chat function. We'll be monitoring that throughout today's discussion. So without further ado, guys, let's go ahead and jump on into our discussion. And I'll let you guys, answer as I pose the questions to you. But the first question that I have to the group are, as we all know, here in DFW, we just had our first cold front, so it's actually kind of dreary outside. It's pretty cold, and we're approaching flu season. And with the global pandemic that's going on, what do you recommend to your patients regarding the flu shot? And if you don't mind, expound on what happens if you get the flu shot, and how is the flu shot different from COVID-19?
So in terms of the flu and flu season, so right now we're in the cold, cough, and flu season. And I would say in terms of what my recommendations are during the pandemic is to continue to get your flu shot because we want to make sure that we're able to rule out whether you have the flu or not. In terms of the differences between COVID-19 and the flu, COVID-19 generally appears about 2 to 14 days after you come into contact with the virus. And although both of the disease states have fever and cough associated with it, COVID-19 has more of a shortness of breath component as well as, the high fevers and the coughs. But with flu, we see a lot of other symptoms such as sore throat, stuffy or runny noses, the body aches, muscle aches, fatigue, headaches, etc. And the time of onset from a flu, when you've come into contact with a patient, is another person who's had the flu is about 1 to 4 days. So I would highly recommend getting your flu shot to increase the herd immunity. Because during the cold, cough, flu season, we tend to stay indoors. It's very common that we're sharing the same air because we're not going outside. So it's easy to transfer the cold, the cough, the flu, COVID-19. And so in order to increase that herd immunity, please go get your flu shot. If you feel that you have the flu, I would say go ahead and get rapid tested. And you can get the rapid flu shot flu test from either your provider or your local pharmacy if they're a point of care testing site. It's important to talk to your providers and also the providers of your children or even your parents about how they're handling these visits during this time period. So for instance, for my kids, the pediatrician's office is not seeing sick visits in person. They're only seeing the well visits in person. And so I'm going to have to find a different way in case they need to get tested for the flu in case they end up getting it. So those are some things that to consider during the pandemic, but I would definitely recommend continue getting the flu shot during the pandemic.
Thank you for that, Dr. Ramanathan. I do have a follow-up question for our audience. So you mentioned some of the signs and symptoms of COVID-19 and flu are a little bit of the same, but it sounds like you mentioned the duration or the onset of when they may start experiencing true symptoms. At what point would you recommend our audience or patients to seek additional care or reaching out to their primary care physician if they start to experience some of these symptoms?
I would say high fevers, past like 102, 103. And then the shortness of breath is a really big issue, especially with COVID-19. And that's why I ask that my patients have on hand a pulse oximeter at home. So if you're noticing that you're having issues with shortness of breath, check your pulse oximeter, which checks for your O2 saturation, how much your body is carrying the oxygen. And if you're low on the oxygen, so low is considered less than 95% and normal is between 95 and 100%, then we might have an issue in terms of your shortness of breath and you may want to contact your provider at that point. So if you're noticing the fever, the cough, and the shortness of breath with a low O2 saturation, please contact your physician provider about COVID-19 and try to get COVID-19 tested.
Awesome. Awesome. Thank you. Speaking of vaccinations, I have another question about vaccines. So obviously there's been a lot of news with everything that's going on about expanding ability of pharmacists. So when it comes to vaccination, especially those for children and even aging adults, is it safe in a pandemic to continue your normal vaccination schedule? And if so, what do you recommend?
So during the pandemic, I would still recommend keeping up with the vaccination schedules that have been put out by the CDC and ACIP. There are separate schedules for the pediatric population and also the adult population. So knowing when those scheduled vaccinations are to take place is very, very important. I've continued to take my children in for their well visits and their vaccinations during the pandemic because I understand how important those vaccinations are for the kids and also for everybody in my family, including my parents. So staying on schedule is very, very important. And as you had mentioned, Dr. George, as of August 19th, the U.S. Health and Human Services has expanded to be able to give these vaccinations to children as young as 3 years of age and even pharmacist interns under supervision. So this is a great place for pharmacists to be able to fill in the gap and improve that herd immunity with these vaccinations.
Awesome. Awesome. So thank you for following up with that about children. Is there any advice that we would give for our aging adults? I know we have a couple of individuals who on the panel who are geriatric specialists. So is there any advice about our aging adults in terms of vaccinations?
So I will continue to especially during the cold, cough, flu season, I would see if you're in the age range where you would need either Prevnar 13 or the pneumococcal pneumovax, because pneumonia is a very big one, especially in those older than the age of 65. So that's another big one that I would worry about. Shingles vaccine is another one that I would recommend for the elderly population. And those are and then of course the flu. So those three are the main ones that come to mind. If any of the other panelists have any other recommendations on that.
Dr. Fix, I see you have your hand up. Go ahead.
I just wanted to mention that our pharmacy students learn to give immunizations during their first semester of their first year of pharmacy school. And then they're later deployed out onto rotations out in the community to community pharmacies. So our students are actively providing immunizations in the community. And I think that sometimes the patients are a little worried that it's a student providing a vaccine. But I'd like to just caution that the students learn early in their experience, and they've already been giving vaccines at community sites for 4 years by the time they're on these rotations where they're out giving vaccines on rotation in pharmacy settings. So the students are well equipped and well prepared to give not only flu shots, but these other routine vaccines that Dr. Ramanathan mentioned. And eventually when the COVID vaccine becomes available, our students will be able to participate in that as well. And we want to make sure that we deploy enough resources in the community to be able to get everybody vaccinated as needed.
Dr. Fix, do you mind? You used a couple of times community in the community setting, and even in several of your bios, we talked about community pharmacy. Can you explain and differentiate for our audience what is community pharmacy so that they can know where to go get those vaccines that you just described?
So community pharmacy is I call it the street pharmacy. It's every pharmacy out in the community. So it's independent pharmacies as well as chain organizations, and grocery store organizations. So we're the pharmacists that are literally out in the community and have patients have easy access to pharmacists out in the, so we got Ziggy. Patients have easy access to pharmacists out in the community, and we want them to access pharmacists as needed for not only immunizations, but questions about their prescriptions as those come up as well.
So that would, just to make sure I heard you correctly, that would be your grocery stores, that will be your retailers, that would be your independent mom and pop pharmacies, right?
Yes,
Awesome, awesome.
DFW
has dozens, if not hundreds of those around, so awesome. Well, yeah. Thank you. Well, I want to continue our conversation around COVID. So what other recommendations does the panel have around, plans to stay safe and avoid COVID through a pandemic environment?
I guess I'll start off with that. Wear your mask. And I would say, I've seen lots of people wear their mask incorrectly. So something to remember is that actually, like, the regular hospital grade masks like these are actually more, they're actually better at preventing COVID-19 than the cloth masks. The data has shown that. But in terms of wearing this appropriately, the colorful side needs to be on the outside, and the white side is usually towards you. It's usually 3 layers and the filter's in the middle. And there's a wire here at the top that can be used to secure this to your nose. And so that's very, very important to remember. So sometimes I'll see people wearing it like this, but you want to make sure that you're also covering your nose, because that's another outlet for which COVID-19 can transmit, because of course it's a droplet and now also considered an airborne disease. So whether you were singing, shouting, talking, as long as you're wearing appropriate PPE, which is the personal protective equipment, and you're also wearing a mask and possibly, like a visor or like a face shield, the likelihood of getting it is going to be very, very less. But if you're not in that situation and you've been talking to somebody who might have had it within the past, for at least talking to them for 15 minutes, we're kind of in trouble. So to protect yourself and also protect your loved ones at home and not bringing it home to your family, I would highly recommend a mask when going outside of the home. And the other thing is being physically distant. And the reason I say physically distant instead of socially distant is that I don't want anybody to be in social isolation, because we've seen a lot of effects of social isolation, and the other panelists will probably talk about that a little bit later on. But that's kind of my main recommendations right there. I've been doing a lot of grocery pickup and delivery services to my house instead of actually going into the store to limit exposure. Takeout occasionally. We've been trying to cook more at the house. So that's another really big thing that we've been doing. Face shields, you know, just trying to avoid touching your face, washing your hands. I think my daughter's seen us wash our hands so many times that she's been very anal about washing her hands as well. So we get her special Bath and Body Works soap and she washes her hands. And, you know, just sanitizing high surface areas is very, very important. One of the things that my father's done for all of our cars is we have a sanitation kit in all of the cars. And so basically it's a COVID-19 kit that includes masks, gloves, hand sanitizer, and then of course, you know, Lysol wipes in the car so that we can sanitize when we come back from the store or anywhere that we've gone. We've invested in an infrared thermometer in the house, and then pulse oximeter as well. In the hospital, at a baseline, we've been recommending, you know, vitamin C about 1,000 milligrams by mouth twice daily, and then also zinc sulfate 220 milligrams by mouth twice daily as needed. But also staying healthy in general is very, very important. So the normal stuff that you did beforehand to stay healthy. So staying hydrated, eating well, boosting your immunity, exercise, sleep, and that type of thing. Should a patient get COVID-19, they say prone positioning, which is basically sleeping on your stomach, is very, very helpful in that situation. And then a lot of people may not have incentive spirometers, which will help in terms of expanding the lungs. But you know, in the case that you don't have that, blowing up balloons or blowing bubbles in water can help with that resistance and improving the lung capacity. Some things that we've been doing in the house continuously is drinking warm water, hot water. And, you know, my friend recently got COVID-19 and she sent us a whole list of things to, you know, kind of keep on hand, because patients may not be willing to eat at all when they have COVID-19. So just having, you know, saltine crackers on hand or tea bags, and then, you know, trying to come up with a plan that should somebody in the family get COVID-19, how is everybody in the household going to isolate themselves from you, or how are you going to isolate yourself from them? So
awesome. Thank you, Dr. Ramanathan. Just curious. So I heard, I was taking some notes. Physically distance, not social distance, wear your mask. This is coming from our infectious disease person. So Dr. Atanda, I'm just wondering, like, what do you tell your patients around how to stay healthy and avoid COVID-19?
Great question. So everything Dr. Ramanathan mentioned is vital in maintaining the, you know, personal health, but something else for us to consider is just, you know, physical activity and maintaining that mental, you know, emotional health as well. So I encourage our patients to stay active. I know we are, you know, physically distant in this time, but trying to leverage technology to stay connected with loved ones and friends is really important in this time. Even within your home, utilizing your everyday equipment and tools to stay physically active. So taking the stairs in your home, taking laps around the kitchen, whatever you can do to just make sure that we're not sitting and being very you know, limited in our movement is really important in this time. Of course, nutrition cannot be overstated. So really ensuring we're having the good vegetables and fruit that we need to support our immune system and get an adequate sleep. So really for every adult, trying to aim for those 8 hours of sleep. Our lives have been kind of slowed down now with things being mostly virtual and at home. So take advantage of this time to rejuvenate and try to get that 8 hours of sleep to really help your immune system be the primary, you know, fighter and preventer of this disease spread. And then lastly, just really making sure that you are in tune with your emotional health. And so reaching out to counselor services, several of them are now virtual. If you're dealing with any kind of anxiety or depression in this time, a lot of has happened with our social environment. So making sure that you have these resources and you're reaching out for counseling services if you need them.
Just one follow-up, Dr. Atanda. So we heard Dr. Ramanathan mention in her hospital, they're recommending patients to do vitamin C and zinc. And you mentioned fruits and veggies to help boost our immune system. Do you have any recommendations for our audience? And well, forget their audience. Do you have any recommendations for me? Maybe they could benefit. But again, I want to hear what you got to say.
Sure. So definitely trying to stay on top of your vitamin C rich food. So really your citrus fruits, tangerines, oranges are very helpful. If you're someone like me who I'm not really a big breakfast person, I've really gotten into the habit of at least having an apple or just some kind of fruit to get me going in the morning, some kind of yogurt to really build my gut and my GI system and protect it from the other kinds of food I might be eating. And then just making sure that you really load up on the vegetables. The one caveat to that is if you are on a blood thinner like warfarin, you want to be mindful about the vegetables part. So really talking to your pharmacist, your healthcare providers about any changes you want to make in your diet specifically to that medication. But if you're not on a blood thinner like warfarin or medications that might have a food interaction, then really trying to incorporate more vegetables into your diet, more fiber-rich foods into your diet as well. So things that have those healthy skin on them, really get into touch with that. And maybe start your own garden. This might be a good time to pick up a hobby and start to produce some food at home as well. So those are some general recommendations.
You would recommend gardening literally in harvest season. Should you that through 6 months?
Do some things in-house.
Awesome. Well, thank you for that. And again, I think you gave us a great opportunity to segue because I want to talk a little bit, how has this pandemic affected your interactions with your patients? Because I heard several times talk to your pharmacist, and you heard it here first, guys. An apple a day might keep the doctor away, but it helps you interact with your pharmacist. Dr. Tanda, that's tweetable. So how have pharmacists, I know you guys have your clinic setting, and if you don't mind talking about it, here on the HSC campus, how do you help your patients manage their chronic conditions? You just mentioned warfarin and blood therapy. So can you talk to us about how do you help patients manage their conditions? But then I want to hear, how are you helping them during this very difficult time?
Sure. So at the HSC Health Pavilion and clinics, we do have clinical pharmacists embedded into our clinics. And clinical pharmacists, of course, have the PharmD degree and gone through pharmacy school, but we also have additional training with residency training that's specific into clinical setting. So either in an outpatient clinic, like you would see at the HSC Health Pavilion, or in the hospital, for example, like Dr. Ramanathan currently practices. And so our role within the clinic setting is to really work alongside of our healthcare providers, like your physicians, your advanced providers, our nurse practitioners, to ensure that our patients are not being supported only with their medications, but just their chronic disease state management. And so we are highly trained in aspects of diabetes management, cholesterol management, blood pressure management, in addition to other disease states like asthma and COPD. And so we help our patients with close monitoring between weekly and bi-weekly phone calls or visits to help them, reach their goals. So for example, in my clinic, working with patients who have diabetes, I will contact them multiple times in the month, typically weekly, and just assess how their nutrition is going, how their physical activity is going, how their medication adherence and management is going, if we need to titrate any of their medications depending on their blood sugar readings. And so we work really closely with our patients to support them in the interim between their provider visits. And we also talk very closely with our providers to let them know how they're doing. And so it's a collaborative team effort to ensure that the patient's at the center of that. And we're able to sometimes catch some acute issues that might happen between, the typical follow-up visits. And so we work very closely with our patients to be that resource. And we also assist with cost management. I work in a geriatric clinic, so I know that Medicare insurance is one of our primary payers and comes with some restrictions when it comes to cost. And so my role is also to review medication costs and see what other resources we have in the community between assistance programs and making some switches with medications to assist our patients if they end up in the coverage gap or just needing financial assistance. Specifically in the COVID-19 pandemic, we are doing a lot of telehealth services, and that's just pretty much talking to our patients like we are right now over video or phone call. That way we don't have to have them have any potential exposure by coming through the community to come to our clinics. And so we can help with telehealth services, and also just really assisting with, like I mentioned, the cost management if anyone's lost a job or are just needing additional resources in this time, and also connecting them to community resources for meal assistance and securing meals, and also social work services by connecting them with our social workers. So we are really hands-on in this pandemic, ensuring that our patients don't fall through the gap and are still getting quality care.
Awesome. Awesome. So I heard you mention just now telehealth. So that is one way that obviously this pandemic has affected how you give care in your practice setting. Are there any other examples of how the pandemic has affected how you work from normal?
Sure. So just thinking about how we actually work as providers. So some of my services are from my home. As you can see, I'm in my office, and having to balance personal life with, working and providing care, that's also been unique, and transitioning a lot of what we do to even just video phone call, video conferences has also been unique with healthcare. And how do we assess our physical assessments, through a video sometimes can be a bit challenging, but we are adjusting as well as our patients are adjusting, and really just taking it, month by month and getting feedback from our patients as to how it's working for them. And as a provider, as someone who is also a parent, trying to find the balance with, still taking care of myself, because I am best serving my patients when I'm at my optimal health, and mental wellness too. So taking the breaks that are necessary in between our patient care activities to also refuel, since we are also experiencing the pandemic as our patients are, has been very helpful.
Awesome. Well, Dr. Wesling, I see you seem to be in your office. I think that's at work, or is that, you got a real fancy at-home office?
No, I am at work.
Okay. So how has this affected you in your practice and how you deliver care to your patients?
I think Dr. Atanda has done a really nice job. I also work at HSC Health and kind of follow in similar steps to delivery of care via telehealth. So optimizing the use of those video calls, of the telephone calls. We have numerous applications and softwares that have been available to us to contact our patients. I think also in our care, we also provide a lot of patient education. And in my clinic, being mostly focusing on chronic conditions, really focusing and diving into diabetes management, that comes with a lot of devices. And so I find myself trying to adapt to an environment where I don't have that patient right in front of me to provide that education. So we've had to be a little bit creative. I'm not afraid to pull out a pen and an orange and walk through some steps on how best to deliver insulin in an injectable and appropriate techniques. We've talked, Dr. Ramanathan mentioned blowing bubbles in water. We also use maybe a whistle to demonstrate some appropriate inhalation techniques when trying to work through how to use an inhaler. Once the patient has that available or prior to that, we can help kind of simulate some of those education pieces that we would have otherwise liked to do in that live interaction. Other things that I've seen come across as well, and especially emphasized in this time, is utilizing our patient portal communication. I like to provide to my patients, or when they're seeking advice, some written materials. What are some good dietary strategies? What are some good at-home physical activity that we can do? We're delivering a lot of that now via patient portal communication or good old mailing system. So I think we've come up with a lot of unique solutions, and we certainly are trying to optimize, like Dr. Atanda said, being at our best so that we're at our best to serve and allow for our patients to be at their best, and finding unique ways to still achieve our goals and our delivery of care.
Awesome. Awesome. So I see Dr. Fix, you had your hand raised. Go ahead.
I really don't have anything to add other than to talk about from the clinic perspective, one of the objectives is to get medication to the patients. And so those prescriptions are then sent to the community pharmacy. where the patients have to go pick up their medicine. So that's where they end up on Main Street at their pharmacist to pick up their medications. And it's really important for consumers to exercise patience at the pharmacy pick level. The pharmacists are required by the state to counsel patients on every new prescription. And so the pickup process is sometimes a little bit longer than the patient is expecting. And the patient may not realize that the pharmacist is required to visit with them about their medication. And so they're wanting to provide important information to the patient so that the patient can safely manage their own medications and be empowered. And so it's just important to understand that the pharmacist is providing a service to the patient that empowers the patient. It's required for new medicines, and that the consumers really need to exercise patience and not think about picking up a prescription like delivering fast food. It's really a professional service by doctorates of pharmacy. Our pharmacy students go through 4 years of pharmacy school. At the end of the day, they're a doctorate. So in the community setting, they're even should be spoken to as Dr. Pharmacist, and maybe provide some appreciation for their level and depth of knowledge. And I would just add one more thing, that pharmacists are so well educated about the medicines. They're just looking for people who care about what kind of information they can share. So the pharmacists really want to help educate patients and share their knowledge and help empower patients. So patients may feel like it's a hurried situation, but if they would make an appointment or talk to the pharmacist and say, I want to have a little bit more of a conversation about this, then the pharmacist can arrange a time to call back the patient or have a set meeting time that's a little less busy, where they can have a bit of a more conversation with the patient. So pharmacists are just really looking to share information with the patient beyond the required counseling. And we just would like for patients to be patient with that process and understand that we want to give every patient the same level of service, and we don't want to shorten the experience for any patient.
Awesome.